California is the first state to have a transgender wellness and equity fund, which is getting $13 million.
The money will provide health care services, among other needs, for transgender, gender nonconforming, and intersex people in the state. Now, it is News reporter Annabelle Munoz spoke to some advocates who led the effort to get the bill passed.
Members of trans communities just celebrated a historic win, a $13 million wellness and equity fund in California. Bambi Salcedo is president and CEO of Trans Latina Coalition, an LA-based organization that led the effort alongside more than 20 groups.
We are going to be able to support trans people with housing, for instance, right? Because that is a health issue. We're also going to be able to support our community with mental health services, with healthcare services, accessibility to competent healthcare services.
24-year-old Michelle de la Cuadra at Trans Latina helped research and write the organization's policy platform, which eventually was instrumental in writing AB 2218.
It was amazing to see this report that was really only a vision, and came from the voices and the minds of community to culminate into something tangible that has now turned into resources.
De la Cuadra explains some of the barriers trans, gender nonconforming, and intersex people experience when it comes to healthcare.
Being misgendered or being called our dead name, or the doctor not really focusing on what the medical issue is and really focusing on our identity because they feel like that's influencing our health, or blaming everything on the hormones, like you're having back problems because you're taking hormones.
Governor Gavin Newsom signed the bill authored by Assemblymember Miguel Santiago in September. The funding was just approved through the latest budget.
And this is really historic because what that means in the state of California is we now begin to formally recognize in the healthcare field the unique needs and wraparound support services.
Our community is still facing rejection from their families. They're still being kicked out. They're still living on the fringes.
Ebony Harper is executive director of California Transcends, which was part of the coalition.
We have some of the highest rates of suicide, particularly amongst Black trans folks. 35 years old is the expected life expectancy.
Interact Advocates is a national organization.
Working really closely with the California Department of Health to, make sure the implementation process is equitable and that resources, actually get to the people as easy as possible. I just want folks to know that it was a roller coaster ride, but I want folks to know that it's possible.
There's still a lot of social issues that need to be addressed, particularly the violence that we experience as trans women. I want to invite for everyone and for people to really understand that it's important that we look at our humanity and that we understand that trans people also deserve a place within our society.
Annabelle Munoz, ABC 7 Eyewitness News.